15 shocking nighttime diabetes signs your body is desperately trying to tell you. Did you know your sleep isn't just downtime? It's a vital window into your overall health, especially when you're managing diabetes. Your body often whispers crucial warnings at night, subtle signs that can reveal hidden dangers. It's easy to dismiss a sweaty night or a leg cramp, but these could be your body's SOS signals about your diabetes. Ignoring them is like ignoring a ticking time bomb. Stay with me until the very end, because some of these 15 nighttime signs are so silent, you might be experiencing them without even realizing the serious risk they indicate. Hey everyone, and welcome back to the channel where we shed light on the often overlooked aspects of your health. If you're committed to understanding your body's signals and taking control of your diabetes, you're in the right place. Before we uncover these critical nighttime warnings, make sure you tap that like button if you've ever woken up feeling off without knowing why. It helps us get this potentially life-changing information to more people who need it. And while you're here, subscribe for more essential health insights every week. Let me know in the comments below. Have you experienced any unusual symptoms at night that you now realize might be connected to your health? 15 silent nighttime diabetes signs you must know. Number 1, night sweats. Number 1 on our list is night sweats. Waking up drenched in sweat isn't just uncomfortable. For folks with diabetes, it can be a key heads up about their blood sugar. Often these night sweats signal a dip in blood glucose levels overnight, hypoglycemia. When your sugar goes too low while you're sleeping, your body releases adrenaline to try and fix it. This adrenaline surge cranks up your heart rate and makes you sweat like crazy. Beyond the immediate discomfort, repeated nighttime low blood sugar can mess with your sleep, leaving you dragging the next day, which can make managing your diabetes even tougher. Plus, really low blood sugar can be serious. It's also worth knowing that nerve damage from diabetes, called autonomic neuropathy, can sometimes mess with your sweat glands, causing night sweats that aren't even about low blood sugar. Bottom line, if you're waking up soaked a lot, it's worth talking to your doctor to figure out why and adjust your diabetes plan if needed. Keeping track of when it happens and your bedtime blood sugar can be super helpful for them. Number 2, leg cramps. Number 2 on our list is leg cramps. Those sudden, ouch-inducing leg cramps that yank you out of sleep can be more than just a random muscle spasm for people managing diabetes. Often, they point to an imbalance in electrolytes, those important minerals like potassium, magnesium, and calcium that help your nerves and muscles work right. Diabetes can throw these levels off, leading to cramps, especially in your calves. Another biggie is peripheral neuropathy, nerve damage from high blood sugar. These damaged nerves can send weird signals to your leg muscles, making them cramp up. Also, poor blood flow, which can be an issue with diabetes, can cause cramps, especially when you're still at night. Ignoring these nighttime leg pains can lead to crummy sleep and might mean you need to look at your blood sugar control and circulation. Making sure you're getting enough fluids and maybe talking to your doctor about supplements could help. Number 3, restless leg syndrome, RLS. Number 3 on our list is restless leg syndrome, RLS. That nagging urge to move your legs, especially when you're trying to chill out in the evening or at night. That's restless leg syndrome, RLS, and it seems to pop up more often in folks with diabetes. While we're still figuring out exactly why, one strong theory links it to peripheral neuropathy, that nerve damage we keep talking about. The messed up nerves in your legs can cause all sorts of weird feelings, tingling, burning, that creepy crawly thing, making you just have to move them to get some relief. RLS has also been tied to problems with dopamine, a brain chemical that helps control movement. Diabetes can mess with your body's dopamine system, which might make RLS worse. Plus, not having enough iron or magnesium can also play a role in RLS, and diabetes can sometimes affect how your body handles these nutrients. Not getting good sleep because of RLS can then make it harder to manage your blood sugar. If your legs are keeping you up at night, it's a good idea to chat with your doctor about it. They might have some ideas on how to ease those restless sensations. Number 4, sleep apnea. Number 4 on our list is sleep apnea. Sleep apnea, where you stop breathing or take really shallow breaths while you're asleep, is more than just loud snoring. It can be a serious issue, especially if you have or are at risk for diabetes. These breathing pauses mean your body isn't getting enough oxygen, which can stress things out and actually make your body less sensitive to insulin. That's insulin resistance. When you're insulin resistant, it's tougher to keep your blood sugar in check. Plus, sleep apnea puts extra strain on your heart and blood vessels, raising your risk for high blood pressure and even more serious stuff like heart attacks and strokes, which are already concerns for some folks with diabetes. Recognizing the signs, like really loud snoring, waking up gasping for air, or feeling super tired during the day, is key. If you think you might have sleep apnea, getting it checked out and treated, maybe with a CPAP machine, can make a big difference in your sleep and your overall health, including your diabetes management. Number 5, frequent nighttime urination, nocturia. Number 5 on our list is frequent nighttime urination, nocturia. Waking up a bunch of times during the night to pee, or nocturia, can really mess with your sleep. For people with diabetes, it's often a signal that your blood sugar might be running high. When your blood glucose is elevated, your kidneys have to work overtime to filter out all that extra sugar. This process pulls more water into your urine, meaning you have to go more often, even in the middle of the night when you should be sleeping. Besides just making you tired, all those trips to the bathroom can also throw off your body's balance of electrolytes and even lead to dehydration. Plus, frequent nighttime peeing can sometimes be a sign of kidney issues, which can be a complication of diabetes. When your kidneys are damaged, they might not be able to concentrate your urine as well, leading to more trips to the toilet. So if you find yourself getting up a lot at night to pee, it's worth paying attention to and maybe mentioning it to your doctor. It could be a sign to adjust your blood sugar control or get your kidney function checked out. Number 6, excessive thirst. Number 6 on our list is excessive thirst. That constant feeling of needing a drink, especially if you wake up in the night feeling like your mouth is a desert, can be an early sign that your blood sugar levels are too high if you have diabetes. This super thirst, called polydipsia, happens because when there's too much sugar floating around in your blood, it pulls water out of your cells and tissues to try and even things out. This leaves you feeling dehydrated and constantly thirsty. And as we just talked about with nighttime urination, your kidneys are also working hard to get rid of that extra sugar, which also pulls out more water, making the dehydration and thirst even worse. If you don't get it under control, this constant thirst can mess with your electrolytes and make other diabetes symptoms feel even worse. So while staying hydrated is always important, if you're constantly feeling like you can't get enough to drink, especially if you're also peeing a lot and feeling tired, it's a good idea to check your blood sugar and talk to your doctor. It might mean your diabetes management needs a tweak. Number 7, pain or numbness in the legs, peripheral neuropathy. Number 7 on our list is pain or numbness in the legs. That tingling, burning, shooting pain, or even a complete lack of feeling in your legs and feet, especially when you're trying to relax at night, can be a big heads up for peripheral neuropathy, a common complication of diabetes. Over time, high blood sugar can damage the delicate nerves in your legs and feet, messing with how they send signals. This nerve damage often starts in the longest nerves, so your feet and legs are usually the first to feel it. The way this nerve damage feels can be different for everyone, but it often gets worse at night. This might be because your nerves are more sensitive when you're resting, or because of changes in blood flow. You might feel anything from a mild pins and needles sensation to really intense burning pain that makes it hard to sleep. One of the scariest things about this nerve damage is that you can lose feeling in your feet, meaning you might not notice small cuts or blisters that can turn into serious infections. So if you're having weird sensations or numbness in your legs and feet at night, don't ignore it. Talk to your doctor so they can check your nerve function and help you manage the pain and prevent it from getting worse, usually by getting your blood sugar under better control. Number 8, nighttime hypoglycemia. Number 8 on our list is nighttime hypoglycemia. Waking up in a cold sweat, feeling shaky, or having a racing heart for no clear reason in the middle of the night can be a sign your blood sugar has dropped too low while you were sleeping. Because you're out cold, you might miss the usual low blood sugar warnings you'd feel during the day. Your body still tries to fix it by releasing adrenaline, which causes those clammy, shaky feelings. Repeated low blood sugar overnight can be scary and can really mess with your sleep quality, leaving you feeling drained. If it gets really low, it can even lead to serious problems. Folks on insulin or certain diabetes pills are more at risk. Things like taking too much insulin, skipping dinner, or exercising hard close to bedtime can cause it. Checking your blood sugar before bed is a good habit, and if it's on the lower side, maybe having a small snack could help keep things stable overnight. If it's happening a lot, definitely chat with your doctor about adjusting your meds or meal plan. Number 9, insomnia. Number 9 on our list is insomnia. Tossing and turning, struggling to fall asleep, or waking up and not being able to get back to dreamland can be a real drag. For people with diabetes, wonky blood sugar levels can play a big part in this. If your sugar goes too high or too low during the night, your body can release stress hormones that keep you wired and make it hard to get good rest. Plus, dealing with a chronic condition like diabetes can be stressful, and that stress can definitely keep you up at night. There's also a link between not sleeping well and your body becoming less sensitive to insulin, which then makes it harder to control your blood sugar. It's a vicious cycle. Getting a handle on your blood sugar, making your bedroom a sleep haven, and maybe trying some relaxation techniques before bed can make a difference. If sleep is a constant battle, talking to your doctor about it might be a good idea. Number 10, acid reflux. Number 10 on our list is acid reflux. That burning feeling in your chest or a sour taste in your mouth that seems to get worse when you lie down could be acid reflux. For people with diabetes, especially those with nerve damage called autonomic neuropathy, reflux can be more of a problem at night. This nerve damage can slow down how quickly food moves out of your stomach, putting more pressure on the valve that keeps stomach acid out of your esophagus. This backup of acid can be really uncomfortable and can also mess with your sleep. Plus, when your digestion is off, it can even affect how your body absorbs sugar and your diabetes meds, making blood sugar control trickier. Steering clear of foods that tend to trigger reflux, like fatty or spicy stuff, especially close to bedtime, can help. Eating your last meal a few hours before hitting the hay and maybe propping up the head of your bed can also ease the burn. If it's a frequent problem, your doctor might have some medication recommendations. Number 11. Nightmares or vivid dreams. Number 11 on our list is nightmares or vivid dreams. Waking up from a scary dream or one that felt way too real can be unsettling. For folks with diabetes, these kinds of intense dreams can sometimes be linked to swings in blood sugar overnight. When your glucose levels dip too low or spike too high, it can mess with your brain activity during sleep and lead to more dramatic dreams. Also, sleep disorders that are more common in people with diabetes, like sleep apnea, can also contribute to more vivid or disturbing dreams. Not getting good, restful sleep because of these dreams can leave you feeling anxious and tired, which can make managing your diabetes harder. Trying to wind down before bed with relaxing activities and keeping your blood sugar stable overnight might help. If these dreams are happening a lot and really bothering you, it's worth mentioning to your doctor. Number 12. High blood pressure in the middle of the night. Number 12 on our list is high blood pressure in the middle of the night. Normally, your blood pressure dips a bit while you're sleeping. But if it stays high or even goes up, that can be a red flag, especially if you have diabetes. Nerve damage from diabetes can mess with your body's ability to regulate blood pressure properly. Also, those blood sugar swings we've talked about can also play a role. Low blood sugar can trigger the release of stress hormones that can temporarily raise your blood pressure. High blood pressure that sticks around at night is a big concern because it puts extra strain on your heart and blood vessels, increasing the risk of serious problems like heart attacks and strokes, which are already higher for some people with diabetes. Keeping an eye on your blood pressure at different times and making lifestyle changes like watching your salt intake can help. If your nighttime blood pressure is a concern, your doctor might recommend medication to keep it in check. Number 13, palpitations. Number 13 on our list is palpitations. That feeling of your heart racing, pounding, or skipping a beat, especially when you're trying to relax in bed, can be a little scary. For people with diabetes, these heart flutters can sometimes be tied to blood sugar levels that are out of whack. When your blood sugar drops too low, it can trigger the release of adrenaline, which can make your heart beat faster. Also, diabetes can sometimes lead to imbalances in electrolytes, those important minerals that help your heart beat regularly. If these levels get off, it can cause palpitations. Plus, diabetes can increase your risk of heart problems in general. If you're feeling these heart-racing sensations a lot, it's a good idea to get it checked out by your doctor. They might want to do some tests to see what's going on and make sure your heart is healthy. Number 14, teeth grinding, bruxism. Number 14 on our list is teeth grinding, also known as bruxism. Waking up with a sore jaw or a headache, or if your dentist notices wear on your teeth, you might be grinding them in your sleep. While stress is a big trigger for teeth grinding, there might also be a link to blood sugar levels for people with diabetes. When your blood sugar dips too low overnight, it can cause a stress response in your body, leading to muscle tension, including in your jaw. Also, nerve damage from diabetes might make your jaw muscles more sensitive and prone to clenching. Grinding your teeth at night can lead to all sorts of dental problems and pain. If you think you might be doing it, talking to your dentist or doctor could help. They might suggest wearing a mouth guard at night or finding ways to reduce stress before bed. Keeping your blood sugar stable overnight might also play a role. Number 15, morning headaches. Number 15 on our list is morning headaches. Waking up with a throbbing head that gets better as the day goes on can be a real downer. For people with diabetes, these morning head pounders can sometimes be a clue about what happened with their blood sugar overnight. If your blood sugar dropped too low while you were sleeping, your brain might not have had enough fuel, leading to a headache when you wake up. Also, sleep problems that are more common with diabetes, like sleep apnea, can also cause morning headaches because you're not getting enough oxygen during the night. Dehydration from having to pee a lot overnight due to high blood sugar can also be a factor. If you're waking up with headaches a lot, it's worth paying attention to when they happen and checking your blood sugar levels. Making sure you're sleeping well and staying hydrated can also help. If they keep happening, talking to your doctor can help figure out the exact cause. So, there you have it. 15 crucial nighttime signs your body might be sending you about your diabetes. Recognizing these subtle clues can be the first step towards better management and preventing serious complications. Which of these nighttime signs were you most surprised to learn about? Share your experiences in the comments below. Your insights could help others. Thank you so much for taking the time to learn about these important nighttime warnings. Remember to like, subscribe, and share this video with anyone you know who's living with diabetes. Staying informed is the best way to stay healthy. Sweet dreams, and I'll see you in the next video.